I am your host, U.S. Army flight surgeon and Iraq combat veteran medic, retired Colonel Dr. Damon Arnold. I have a very special panelist today who's written an extraordinarily well-written article. And our panelist is Fred Schulte. He's a senior correspondent for KFF Health News. Kaiser Family Foundation, KFF, is a nonprofit foundation that does research, journalism, and communications programs. It focuses on major healthcare issues in the United States. Today's discussion is Fred's KFF Health News article, The Medicare Advantage Influence Machine. The new court filings and lobbying reports reveal an industry drive to tamp down critics and retain billions of dollars in overcharges. Hello, Fred. How are you doing?
Oh, I'm fine. How you doing, Dr. Arnold?
Great. And you wrote this article on September 30th, 2024 with Holly Hacker.
Right.
What was your motivation for writing this article, and why is it important?
Well, it was about the Medicare Advantage program, which if you're on Medicare, you can go into it. You can get a supplemental plan, or you can join one of these private insurance plans that are basically run by big insurance companies. And it's open enrollment season now, so that thought. And there's also been a lot of controversy about whether these plans are overbilling the government, and so. And there's some concern in Congress that this is going on, and there needs to be a crackdown on it. So we decided to look at what the industry is doing and how they're trying to use their considerable political power to well, I don't want to say to silence critics, but to get their message out to the public at large. And their message is that they're a very valuable service, and that they don't want anybody or they don't necessarily want regulators to be cracking down on them, and they dispute the fact that they're getting overpaid. And now the government says that it's paying these plans much more than if the same person was in a in the original Medicare, and they want take steps to crack down on them. A lot of these are for-profit plans, and the critics are saying that they're making a lot of money, they're making too much money, and that they're kind of taking the taxpayers for a ride.
Yeah, because you really talked about them as being a politically potent juggernaut in the article. And that really brings in the image of the range of power they have, and that you mentioned that 33 million seniors were aggressively being brought into these programs. I remember, there was one particular program, I won't mention the name on the air, but they were saying, well, you're a veteran, you can get, if you come with us, because I'm already on the TRICARE because I retired from the military. And they were saying, if you come with us, we can give you $125 back a month. And I was like, what's your incentive to do that? And I never did join, but I was just trying to figure out why were they trying to pull me in to this system in that way? But you had mentioned also in the article about there were so many different ways that they were penetrating the media, the Super Bowl, those kinds of things in 2023.
Right. Well, I'm sure anybody that watches TV has seen these ads. I mean, and during certain times, there's just a flood of these ads. And sometimes they have, big name celebrities or former athletes. I don't want to mention any names, but there's some well-known athletes who are out there trying to recruit people to join these programs. I think some of the critics are saying, well, there's a lot of money being spent, and that just kind of shows you that how much money there is out here. And a Super Bowl ad, when you run an ad during the Super Bowl, you're talking about big money. And so that I think that concerned a lot of people. But I think sometimes, the industry says that, overwhelmingly the people that join these plans are happy with the service they get. But I think the critics say that, well, a lot of these plans save money by cutting back on the number of doctors you can see and the number of hospitals you can go to. And that if you get really sick and you want to go to a certain hospital because you think they have better treatment, well, you may be stuck with only being allowed to go to the hospital that's in their network. And sometimes these networks get narrower and narrower, and some hospitals are saying that the health plans don't pay their bills, and so they're refusing to accept them. So you can get a lot of problems if you're in one of these plans, and all of a sudden they won't take your doctor or they won't take the hospital you want to go to.
And there was something else you described that was really worrisome to me, was the idea of a revolving door, for senior CMS officials and personnel, and how they were sort of cycling back and forth between these programs and federal government.
Right. Well, I think when, the Centers for Medicare and Medicaid Services is in Baltimore. It's the Medicare agency that basically runs the program. And, I think people that work there get a lot of expertise in running and regulating the program. And then they do, in fact, leave the agency and then go to work for the same plans that they used to regulate. And, this is kind of something that happens in government routinely. And the critics of this sort of thing say that, well, if you should be cracking down on these plans, but maybe you're not, because you're thinking about, well, in a year I might want to get a job with one of them, and they pay really well, because you're talking about, this is a $462 billion a year program. With a lot of very, very big insurance companies. And so there's a lot of and when you work for the government, you do develop a lot of expertise that's valuable to the private sector. But I think that the people that are critical of this want to make sure that there isn't people pulling punches because they're going to get a job down the road.
Yeah, and one of the things that is really deeply worrisome about this as well was Senator Chuck Grassley, in your article you mentioned, a Republican from Iowa, said Medicare Advantage fraud is wasting taxpayer dollars to the tune of billions. And what worries me about that is the taxpayer dollars, and we're losing billions of dollars. But the question is the quality of care. Is that actually going to take care of people or not? And from what you were mentioning to me about, well, if you have a Super Bowl ad, I know that's billion. I'm not sure how much they charge, but I know it's in the millions to get any space or time.
Well, Senator Grassley's been a long time critic. He's generally been very supportive of whistleblowers. And in the Medicare Advantage program, there's been a lot of whistleblowers that worked for the industry. And then, they say that, well, the plan's ripping off the government and charging too much, or upcoding, as they call it, so that it's a little complicated. And the plans are, the government is paying these plans based on how sick you are. So the idea is, you don't want these plans refusing to take people because they've got some kind of an illness that could be expensive to treat. But the health plan doesn't want to take somebody that's going to be expensive to treat unless you give them extra money. But what can happen is that they have an obvious incentive to exaggerate the level of sickness you have. So, like, if they pay you one rate for diabetes, but if you have diabetes with complications, they pay you a lot more money. Well, there's an incentive for them to say, well, yeah, you got complications there, so they can get more money. So there were a lot of these whistleblower cases that were being brought under the Federal False Claims Act, which is a thing where you can file a federal lawsuit on behalf of the government and try to get the company to refund the money, under these kinds of cases, you can a health plan that engages in this overbilling can get treble damages, 3 times the amount that you sold. So it can be very lucrative, and the whistleblower gets a piece of the action, so to speak. So it can be a good way for the government to recover money. But anyway, Grassley's been very supportive of these efforts because he doesn't want to see the government getting ripped off. So I think what's happened over the years is there's just audit after audit after audit after audit that tends to be finding these same kinds of overpayments that are related to this upcoding or this exaggerating of how sick people are. And they're doing things like they're going through medical files, and they pull your medical file and they look in there and see if they can find some diagnosis that they can put on your record and then charge the government for. And I think that what Grassley was saying there is that this has been going on a long time, and he and some other people on the Hill want to see an end to it.
Yeah, that makes a lot of sense. I'm glad that we have senators that are paying attention to this and are responding in the right way to try to bring some light to these issues. And one of the things that was really sinful to me was when you were mentioning that you were sort of echoing some of the things that you said about these companies allegedly skimping on vital health care. But also sometimes even dumping thousands of members off these plans because they're not profitable. So if the person can't bring a case to the table, a medical health care case to the table, they'll drop them because then you're not bringing me enough money. That seems to be horrible.
Right. Well, a lot of these are big, they're big insurance companies, and they have contracts with the government for, cities all over the country. And, some cities that they have, they have more members or fewer members or something, but some of these markets just, they're not making enough money. They think they're not making enough money. So they can just go, well, we're leaving. And, it could be really bad, when you're a senior citizen and all of a sudden this happens to you. And, you got a lot of people on this program that, in their 80s or something like that. You don't need this hassle, and,
Right.
it's complicated enough trying to figure out what's going on here. And all of a sudden you get this letter from the health plan saying, you know what, we're leaving. And
Wow.
like,
Wow.
wait a minute, man. And a lot of people like maybe our age, you're dealing with your parents sometimes got to deal with this. And so it can be, it can be very, very confusing. But, I think if you step back a little bit and you look that if you set up a program and you invite private for-profit insurance companies to come into it, they're going to want to make a profit, and you can't really stop them from, leaving the market that they consider is not profitable. But the problem is that's between, the insurance company and the government, and you're the patient. You're caught in the middle here, and this is not good.
Yeah, not at all. And then, one of the things that there was they had someone you mentioned spokesperson for the Better Medicare Alliance was talking about the open enrollment period. It starts in mid-October, but they were afraid that there would be fewer benefits and fewer plan choices. So that seems like it's a changing landscape now. It's almost like I was thinking about in a sense of insurance companies for property, and it's like, well, you live in a flood zone, so we're going to cut out the flood insurance.
Right. Yeah. Well, this came up because basically the Medicare agency is saying well, we're getting all this criticism for paying too much to these health plans, so we got to cut back. We're going to cut back what we're going to pay them. And then the Better Medicare Alliance represents the well, they say they're a grassroots organization, but they have a lot of industry. I mean, they're basically the industry, and they're saying, well, if you cut back on how much you're paying us, then we're going to have to cut back on the services that we offer. And that's where you get into the influence game, because all of a sudden thousands of senior citizens are being told they're not going to get health care, and they complain to their congressman, and then you have
back to CMS. Right.
Yeah, you have a big to do. And I think one of the things that is that the CMS, I mean, they're regulators, and they're supposed to take into account and make sure that they take care of taxpayers' money.
Yeah. Yes.
But on the other hand, they want to provide services to people on Medicare. So
right, double-edged sword.
When they don't want to find out that well, such and such an insurance plan in like in Chicago or somebody's saying, well, we're just going to dump 10,000 members, and because it's chaos, it causes chaos, and they really don't want to do that. So I think some people that are critical of the agency say maybe that they can get pushed around a little bit And
Okay.
that was part of that. That's why we were looking at, the influence that the plans have.
Yeah, because some of this is really delegated from the federal government to states, right? I mean, in Illinois we have Health and Family Services and that kind of thing, and they sort of
Right.
oversee the programs as well. And in Illinois, I think we really decreased. I don't want to quote the wrong number, but it was somewhere in the teens, and now we're down to in the single digits of these providers and insurance companies because they are consolidating and getting a larger piece of the market share. So they actually have more and more influence on how this is being distributed as well.
Yeah, well, I think that's what some of the critics are worried about, that if, you're totally reliant on these big companies, and then you're totally reliant on them. And then if the company decides that they don't want to be in the market anymore, or they don't want to do this, and then, and what you really want to do is you want to protect the patients, because that's
Right.
what your
Right.
real concern is. But yeah, I mean, that's one of the things that with this concept of privatizing, if you whether it's this, space program or healthcare, if you invite private companies to take over the business, then you're going to have to figure out how to deal with them and make sure that they're treating the patients right, and they're not doing things like overbilling and that sort of thing. But primarily, you want to, ensure, what you call continuity of care. You don't want to have these situations where an elderly person is suddenly, goes to the hospital and suddenly they're refusing to pay. And that's just, how terrible that is when you get a situation like that. And it's scary that you're going to get stuck with this huge bill, and it's just not good.
Yeah, because I was actually in the state of Illinois, so I was running the Illinois Department of Public Health, and there was
Mhm.
a revolving door policy that's in place, and it seems like in this kind of setting, you really want to be careful about conflicts of interest, with people being able to rotate back in and out of the industry. Uh,
Mhm.
and it seems like we need to have some stronger regulations around that or something that is preventing that.
Right, that's in the Medicaid program, I think, with the Illinois Department of Public Health. Well, I think that all around the country, Medicaid programs have, because in fact, we came up to Chicago once years ago
Yeah. Mhm.
to talk about that with Quentin Youngs was
Oh,
there.
Quincy Young. Yes, yes, I know
Uh,
him. Yeah, great.
yeah, a good guy. And
Yeah.
and but anyway, that was one of the things that was going on, is that the various states were turning their Medicaid programs over to private companies, and the private companies were hiring people out of state agencies like crazy. And like you're saying, the revolving door, and it did have, real conflicts of interest, because some of these plans, they were just not up to snuff. Some of them were just, very quickly thrown together by investors, and the quality of care wasn't that good. And but they would be hiring all these people from the government and from the state government, and so it raised that same conflict of interest.
Yeah. What do you see as some potential solutions to this? I mean, where do you think people should be focusing? Should we be writing congressional members? How do we get this resolved? Because we do have budgetary problems all over the country. I mean, state,
Mhm.
local government, federal government, where they're having shortfalls in the amount of money they have to actually expend on different needs within the communities and within the country. So, how should we approach this problem as taxpayers?
Well, you want to make your voice heard, and I mean, I think that one of the problems that, and why there's influence, is that these big companies, they have a lot of influence, and they can, if they don't like something, then they can get 50 members of Congress to write to the Medicare agency and tell them to quit bothering my client. you know but what you want to do is you want to be able to try to equal that out somehow, and so you have to figure it. You have to basically, you have to be the squeaky wheel. And if something happens to you and they're trying to charge you too much, or you have to just keep complaining, and it's an unfortunate situation, but you've had a lot of these health plans that required prior authorization for some service, and your doctor says you need some medical service, but the plan says, well, no, we got to check this out first, and then you wait and wait and wait, and then they say no, and then you have to appeal, and people can lose interest, and you can't do that. I mean, you have to fight for yourself and represent yourself, or get a family member or something and keep bugging them until they do what they're supposed to.
Yeah, and that's a really extremely, extremely important point. Because I'm a physician, and many times patients come in and they are reluctant to come in to begin with because they think, they say they think you're going to find something, and it's like, well, yeah, we want to look. So if we do see something, we can, do something about it. And if they are going through too many regulations and requirements, and especially if they're senior citizens or will have Alzheimer's disease or dementia, those things kind of setting in, it's very difficult for them to interact with the system and to follow all these procedural steps and making sure they fill this form out and that form out. And so that there are some organizations out there that are directed at care delivery, where they follow the person and their advocates that are out there. But if someone doesn't have that, it can be really daunting to try to go up against a major company. I mean, if government has problems with controlling them, think about the average citizen.
Right.
Trying to get care.
Absolutely, and but you have to just try to complain to as many, and call there are, like as you mentioned, there's agencies that do help the public, Medicare advocacy agencies in most cities, and you have to write to them or call them or something, and hopefully they'll help you out. But you're right, it can be terrible trying to navigate all of this.
Yeah, because my big fear is that if you have a delay in care, that if they have something like a cancer that can progress from stage 2 to 3 to 4, this is something that your delay in time is actually worsening their prognosis.
Absolutely. Yeah, well, we have, in fact, I mean, over the time years ago, we saw a number of health plans where you had that, where somebody would go and go to the doctor and say that you got something hurts, and then they give you some pills or something, and you go back and say, no, it's not working, and you keep going and going and going, and they give you some cheap pill, and then finally you got fed up. And you say, I'm going to another doctor, and then they tell you, well, all along you had cancer, and it's progressed, and that you don't want that to happen to you. So that's another reason why you have the bottom line is you really have to take responsibility not only for your own health, but unfortunately you have to take responsibility for your own health care too, or have a family member or find somebody to advocate for you as you go through the system, because you're right, it's very daunting, very scary, not to mention it can cost you can get threatened with these bills and things, which is really scary when you don't have a lot of money.
Well, I think your article is really very incredibly written, and it's I really enjoyed reading it. Maybe is there a place that people can go to find your articles, that website or?
Yeah, it's KFF Health News, and you can just Google it, and then all of our articles are on the website, KFF Health News.
Yeah, it's extraordinary articles that you're putting out. I was actually dipping into a few other ones. I ran out of time because we had the show. I was looking at articles this morning and this afternoon. But I think we have a wealth of information to have you back on. To keep talking about topics. But so any final words on this topic that you think people just need to keep in their head, or make sure that they are paying attention to?
Yeah, I think we as taxpayers need to do whatever we can to make sure that when we need Medicare, that it's available, and that there's enough, that isn't all being wasted. And I think that the taxpayers need to know that the government is taking care of their money, and that's the bottom line.
Yeah, and it's interesting because we often hear a lot about Social Security. Is that going to run out? But we never talk about Medicare and Medicaid and how it's being impacted.
Yeah,
um,
well, it's a lot of money. Like I said, the Medicare Advantage program, uses $460 billion a year. So there's a lot of money, and I think everybody wants to see it run efficiently, and you want to make sure that people get the care that they need. You don't want to have too much care, but you don't want to have too little care, and you don't want to have these programs figuring out how to rip off the government. That's not good.